So telehealth was probably the first and the worst of the privatization efforts in Alberta. It was a group of people who later turned out to be less than sterling characters, who wanted to lease 2 unused floors of the Leduc Hospital, use them to do hip and knee replacement surgeries for patients that they would bring in from outside the country, who would have their surgery and then go on to have vacations in the Rockies. It didn't seem to occur to them that after you've had a knee replacement or a hip replacement, you're not really into visiting the mountains, but that was their idea. They also looked at the Isley Hospital too, and they ended up actually building a facility somewhere in the southern Atlantic and on some island, where they did vacations for people who needed kidney dialysis. I don't know if they're still going or not. But it was, as I said, a not very salubrious operation. The person in charge happened to be married to a doctor who worked, I think, at the Grey Nuns. And between them, they came up with this plan and brought a few other people on board. The Leduc Hospital at the time was under the hospital board out of Wetaskiwin. It wasn't part of the Capital Health Board. Crossroads Regional Health Authority. And the Crossroads Regional Health Authority thought this was a great plan. Possibly, well, nobody knows why they thought it was a great plan, but they also thought it was a great plan to have one of their doctors tell other doctors in the region to flower up diagnoses so that patients could be transferred into the city. They had some very odd ideas on how to save money. They were the first hospital board, I believe, that was wrapped up when the amalgamation took place, and probably the cause of the amalgamation. Essentially, because there was just one disaster after another with them. So it was an interesting time, but as I said, I went to a meeting, a nice quiet person, and unfortunately I was too quiet to say no when they said, would you do this? Most of my memory of that time is a complete blur because I was exhausted from morning till night for months on end. But we started organizing very quietly, actually. We started with the Friends of Medicare Commission. Several of us toured the province and asked Albertans to come and tell us about their experiences with healthcare and what they would like to see happen. We produced a booklet from that, which we released and gave to every member of the legislature. In fact, the release coincided with the healthcare summit that Mr. Klein organized, so that worked fairly well. But the healthcare summit itself didn't please Mr. Klein, I'm sure, because it actually said what we had been saying all along, that Albertans don't want a second tier of healthcare. They don't want private for-profit facilities. They want the public system to provide the healthcare they need when they need it. And that could be done at less expense than it would be if there's a corporate entity involved. So then we started the actual Bill 11 campaign. Started off quietly with the public meetings arranged across the province. I went off with Kevin Taft, I believe it was. We did public meetings. At the time he had written now.
The Trojan Horse?
No, it was the other one, the one with the Band-Aid on the front.
Yeah. Yes. In fact, it was called Band-Aid, I think.
Was it? Yeah, it might have been. Anyway, he and I toured the province doing little town hall meetings, except they kept getting bigger. And by the time we had done Red Deer and Lethbridge and we were in Calgary, the halls we had booked were no longer quite big enough. And I remember making frantic phone calls back to Edmonton saying, we need a bigger hall, we need a bigger hall. And Gil McGowan, who at the time worked for the Alberta Federation of Labour instead of being its president, kept saying to me, if it's too big, it won't look as if there's anyone there. And I said, I don't think that's going to be a problem. So by the time we got to Edmonton, we had the Polish Hall. Someone actually called the fire department and complained that we had too many people packed in there. And Audrey Cormack, who at that time was the president of the Alberta Federation, told whoever came in from the fire department that that was fine. If they wanted to tell people that they had to leave, they were welcome to do that, but she wasn't going to do it.
That's very good. Yeah.
So it was, it surprised us.
Really?
It did.